You may begin
Good
your
morning.
comments.
Thank you. My name is Krish Gundu. I'm the executive director and co-founder of Texas Jail Project. We're a very small statewide organization that works on the intersection of the pretrial detention system and the mental health system. I want to really thank Director Armstrong today from the Texas Commission on Jail Standards for his presentation and for working closely with us to mitigate harm for behavioral health patients who are pushed into the criminal punishment system. He and his staff worked closely with us to draft guardianship rules for incarcerated people who have guardians to ensure that the guardians have the right and access to engage in medical, legal, and other decisions on behalf of their wards and jails. Many of these people, as you know, are people with IDD, so we're really grateful for their collaboration on these rules with us. I'm also grateful to Director Armstrong for working with us on the CCQ rider, the Continuity of Care rider, which mandates the data collection and the report that he talked about. I'm very excited to see what comes out of that report at the end of the year. I wanted to refer to something that I had said at the last meeting in November when this council met. I had shared data from the forensic audit report that was mandated by Senate Bill 1677 under the 88th legislature. Since the Jail Commission and the LIRA were presenting today, I wanted to make sure that this council was aware of an IDD-related data point that was completely left out of the forensic audit report. The report was silent on the number of people with IDD who were placed on the forensic wait list. So we made an open records request in March of 2025 with the HSC, and I wanted to share that data with this council. So we learned that as of 11th March of 2025, there were a total of 103 people with IDD who were waiting on the forensic wait list. At that time, 93 people with IDD were in state hospitals undergoing competency restoration. 1/3 of those 93, so approximately 30, had previously undergone competency restoration, so it wasn't their first time. At the same time, 210 people were at SSLCs on forensic commitments. The SSLCs had 68 people waiting in jail, waiting for SSLC admissions, and they were anticipated to be through both forensic and civil. So one of the data points we learned at the IDD advisory committee that the Texas Commission on Jail Standards runs was that the largest number of transfers of people with IDD to SSLCs originates from jails. So I have 3 requests for this council, one specifically to the LIDAs. Let's check only flags people who have engaged with the IDD system in the 3 years prior to the date of jail booking. But it's our understanding that once a person is diagnosed with IDD, it never goes away. So limiting the Let's check to 3 years may be eliminating identification of people with IDD who may have had a break in services. So we request this council to please look at that parameter. My second ask is that the criteria for the inpatient care wait list be expanded. We have almost never had a case in the past 8 years when a person who ended up on the forensic wait list did not repeatedly seek a higher level of care prior to their incarceration. They most probably met criteria for civil commitment, but were not placed on the inpatient care wait list. I think we as a state have become extremely comfortable with institutionalizing people, and especially those with IDD in jails. And so I would love to see some recommendation out of this council to reverse that trend. And my final ask, in the same audit report, it was noted that in a 5-year time period, 168 people had timed out on the forensic wait list, which means that they could not make it to competency restoration. But there was no continuity of care mandate that connects people with services when they time out while they're on the wait list, and they're just released back into the community. So this is something that I had mentioned last time as well, that we would love to see a recommendation for a very clear mandate for continuity of care. Thank you. One last data point I want to leave you with, since Director Armstrong talked about custody. That's in that same 5-year period, 54 people died in custody on the wait list while they were in jails waiting for restoration. So I hope this council centers the experiences of those people as you consider recommendations to the legislature. And thank you for your time and thank you for listening. Appreciate it.